Joyce understated things a little bit when she said go back a ways, because our collaboration here extends a little bit beyond helping to discuss how this presentation could come together. So this is one of those little known factoids. I first started in shelter medicine back in the 80s at a very small little shelter outside of Philadelphia as a newbie who really knew nothing about shelters, and I'd never even been one. I'd never even been in one when I started working there. And very early on, one of the first people across our doorstep was Joyce Briggs, who was with a very small little grassroots organization called the Spade Club. And at that level, what Joyce was doing is just handing out certificates for spay neuter, you know, dog by dog by dog at shelters in southern Chester County. So here we are. Who would have thought exactly? And certainly, I don't think in that day and age, any of us could have imagined the progress that would have been made and how spay neuter has influenced our lives and has improved benefits for companion animals. But as with many successful clinical interventions, safety signals or adverse events have started to pop up in various places. A lot of this has been from epidemiological or observational studies. And these epidemiological or observational studies have the advantage of being very relevant to the real world because they're dirty and they're messy and they're exactly like life is out there in shelters and in the population. But because of the inherent biases, and this isn't a criticism of any individual study, it's just a problem with any epidemiology that you do because it is uncontrolled and it's messy in real world. It leaves, while it can be very powerful for sort of identifying risk factors and saying, something might be going on, it leaves a lot of unanswered questions, and particularly with respect to adverse effects of spay neuter in terms of how widespread they are, how real they are, how they affect different populations. Now, fast forward past the epi studies, which I happen to be more familiar with because I am an epidemiologist. I don't know too much about bench science at all. And so when we were working on this presentation and I started talking to both Joyce and Michelle, personally, I was blown away by some of the stuff that is happening in that area. Because this laboratory research, or whether it's in vitro research or it's in laboratory animal models, provides a completely different window than epidemiology to sort of look at and explore and understand these issues. And as you've heard, I'm sure you've gleaned this already just by the last presenter, this is a really exciting time because we're able to look at these things now in the laboratory by employing incredibly sophisticated techniques. I got a little bit about what gene therapy is about, but honestly, I don't pretend to begin to understand it yet. But it's fortunate that we have scientists now who are applying these very sophisticated molecular techniques to be able to look at what spaying and neutering is doing to the body at a cellular level. And that's going to provide some answers that we didn't have before. So in presenting these two sessions this afternoon, I believe the goal was to give you a sense of what these two very different disciplines, epidemiology and laboratory science, have contributed to our understanding of what's happening with spaying and neutering. And I really do want to emphasize that it's really important to recognize that these two approaches are complementary. They're not in competition with each other. So they're going to answer different questions to some degree, and they're certainly going to approach looking at these questions in different ways. So I don't know that you should expect a consensus out of this. I don't think you should expect that there's a synthesis even of the evidence, but I think it's going to point the way to looking at this in the future. And hopefully everybody here, as certainly I felt I did just by looking at both of your presentations, are going to come away with a better idea of how to begin to assess the risks and benefits, and especially to be thinking about them differently, as again was just mentioned, in companion animal populations and feral populations, free-roaming populations, working populations, et cetera. So that said, I guess we're not actually doing formal introductions because you have an app. It is 2018, I guess, so everyone can tap away. And I am not going to sit up here because I want to sit back there so I can see both of your presentations. So Margaret, I think you're up first.
Okay, so like Gary, I'm a veterinary epidemiologist, and like most epidemiologists, we're really good at figuring out what's also wrong with research. So I'm going to talk a little bit about the epi side and the strengths and weaknesses and some considerations when you start to look at the literature. Epidemiology is just the study of health and disease in populations. And as Gary said, this is sort of observational. It's out in the world. So the other thing is that we're not really going to talk about cats. Boo. But the reason that we're not going to talk about spay-neuter, surgical spay-neuter in cats, is that there's actually relatively limited controversy at this point about it. Partly, I think, because of the strong behavioral benefits of spaying and neutering cats. It's pretty clear that living with an indoor cat who's not been spayed or castrated is going to be a challenge. And it's hard to keep cats from slipping out and getting pregnant accidentally. We also, at least certainly in this country, have the big issue, our big species of population control is kitties. And we're pretty confident that mammary cancer and certainly pyometra, infection in the uterus, are prevented. So we're not going to talk about that. What we're going to be talking about today is dogs, because that's where the controversy lies. So I'm going to just touch for a minute on how we kind of got here and how come in 2018 we're suddenly talking about spaying and neutering, which we've been doing for very many decades. I'm going to talk about causation because that's really what this whole question of spay-neuter side effects is about and why it's challenging for epidemiology to ask and answer those questions. And then I'm going to very, very briefly, this is not a review, touch on some of the limitations of existing knowledge of spay-neuter and behavior and spay-neuter and health problems, and then where to now. And then Michelle will pick up. So, we started doing sterilizations in the mid-1900s, which nowadays sounds really a long time ago. Veterinary medicine continued to evolve. We got good anesthetics. We got pain medication so we could keep our patients still. We'd already been doing livestock sterilization, not always with good anesthetics and pain management, but we were doing it because we needed to for various reasons. And then people started moving from the farm to the city, and dogs started to become pets, not utilitarian working animals, and moved into our houses and our beds. And it became inconvenient to have them reproducing or to have them in heat in our houses. So initially, it's probably likely that we started doing surgical sterilization in this country for owner convenience. We were trying to get a handle. Anybody who's lived, my puppy bitch just went through heat this spring. It's like, I never want to have that happen again. And then we evolved our conversations to be thinking about controlling populations, the shelter world, all of those changes. And it's really been pretty recently that we said, how did we get here? So that's all I'm going to say about how we got here. There are actually some resources out there, but I think it's partly that we're starting to get a handle on populations in some cases in parts of the US of dogs and cats. And I think also we have some new technology and other options, and non-surgical sterilization becomes a potential reality for us. So the reason that I was asked to talk is that the question is, how does spaying or castrating a dog cause an outcome? And that's really what the crux of the matter is. In epidemiology terms, the spaying or castrating is the exposure, the thing we want to study, and the outcome might be hip dysplasia or mammary cancer or urinary incontinence. And I've got this little diagram up here. Some of the pictures that I have here are out of the human medicine because we don't have a lot of really good stuff out of the veterinary world. Just to illustrate obesity in people, in animals, it is multifactorial, it is complex. There are a whole slew of reasons, a whole slew of things that potentially together cause obesity. So we're looking to understand causation, and I'm going to spend a number of slides talking about how the scientific world figures out whether one thing, the exposure, causes an outcome. And really it's about, unfortunately, it's not a yes-no question. It's really about compiling different kinds of evidence from epidemiologic studies, evidence from bench work, evidence from all kinds of different parallels that I'll show you, until there's a critical mass that the scientific community says, okay, we're pretty comfortable that this causes that. So that's partly why this is so freaking complicated. So I just pulled smoking and lung cancer because everybody's familiar with this. This was actually studied, and some of the criteria that I'm going to talk about for causation were put forth in 1965. How many of you believe that smoking can cause lung cancer? This is not a trick question. Okay. So we're pretty comfortable that that's the case. And yet, not all smokers get lung cancer, and not all people who get lung cancer of that kind smoked. So here's an example of a really obvious thing. We are quite comfortable with causation. There's tons of evidence, and yet it's not a one-on-one predictable thing. So the other thing to keep in mind is that when we're looking at the adverse events or the potentially outcomes, the potential bad things that might be happening, they're not all equally important or equally common, and we need to be thinking about that, and that, of course, influences also the research and the research priorities. And we've been, for a very long time, pretty limited on what we could do relative to research because there's just not been the funding. So I'm going to walk through some of these. Hopefully I won't bore you to death. But one of the things that you always start with is the time sequence. And you would think it'd be pretty obvious that if you're looking at spaying or castrating a dog, and you're looking to see whether it causes hip dysplasia or not, that the spaying or castration has to happen before hip dysplasia. That's actually much more difficult to prove than you might think it might be. So even though this sounds really obvious, and it is fundamental to causation, it can be tricky to do. Strength of association says that there's a statistical significant connection when we do our statistical calculations, and that the exposed group, the group that's castrated either young or that is castrated at all, that they're at increased risk of whatever our outcome is. In this particular case, this happens to be cats because they had some nice data to illustrate this. This was a study that looked at intact cats compared to the age at which you neutered, you spayed female cats, and then the frequency of mammary cancer afterwards. Unlike dogs, for cats, mammary cancer is often malignant. It will often spread, and it's pretty ugly. So if you spayed these cats at less than 6 months, compared to the intact cats, they were 95% less likely to get mammary cancer. So they're half as likely to get mammary cancer. If you spayed them between 7 and 12 months, they were 82% less likely to get mammary cancer. So almost the same. That first year, if you spay them that first year, they're much less likely to get mammary cancer. But if you waited and spayed them after a year or between 1 year and 2 years, then even though it looks like it's a little protective, it's actually not significantly different from the intact cats. By the time they've hit a year or older and you spay them, you don't get any protective effect from spaying them compared to the intact group of cats that were studied. The really funky thing is that when you look at the cats who were spayed at over 2 years, they were actually at increased risk compared to the intact cats. And we're like, how can that be? Aren't they kind of like the intact cats? That's because it turned out that the population of intact cats they were using as a comparison was a young group of cats. And in young cats, this is a disease that you see as cats age. So of course, the older cats had more mammary cancer. And so this is just an example of, while I believe that spaying cats younger is protective for mammary cancer, epidemiology is hard and it doesn't always come out exactly the way you wish it would. The idea of consistency of evidence is that if you look at this from different populations, different geographies, and different kinds of studies done in different ways, you get the same kind of information. And it also goes to the idea of, are there mechanisms that support this connection? So this graph is from the tobacco world again. This is cancer. The blue line is the per capita cigarette consumption, and the red line is the male lung cancer death rate. You see that if you wait, there's a lag period before lung cancer starts to go down, but it runs totally parallel to cigarette consumption. And this is just one piece of evidence that one might use to say, oh yeah, we're pretty comfortable that cigarette smoking and cigarettes cause lung cancer. So this is just an example of another kind of data. Specificity used to be something we put a lot of weight on. Nowadays, it's really something that has to do with the molecular mechanism. Can we go in our laboratory work and say, we understand about these cells and these receptors and these DNA things and all that stuff? Can we make sure, can we explain this? So that's not something epidemiology is going to really be helpful for us. That's something where the basic research can help provide us with new and interesting kinds of evidence to support or not the connection between spaying and castrating and outcomes. Dose response. This is also not a requirement, but it's kind of nice to see. So if you got, in this case, it's people who smoked their whole life is the top bar, so the more you smoked, the longer in your life you smoked, the more likely you were to have cancer. If you didn't smoke ever, you're very likely not to have cancer. So this is kind of a dose. It's a titration. So more of the bad thing makes it more likely that you are to get the outcome. In our cases, sometimes it can also be flipped around, like the cat example, where spaying earlier decreases the risk from repeated hormonal exposure, and we have a potential mechanism there. Plausibility is one that we really like to point to. Does it make sense? The problem is that it entirely weighs on what we know now. And if we don't know what we don't know, so it's really a tough one to use. And yet it still pops up and people say, well, that doesn't make sense given what we know. And that makes a great question for the next research project to say, well, what do we need to research so that we do know enough to be able to say, is what we're finding, is this connection between spaying and knee problems or spaying and hemangiosarcoma kind of cancer, is that plausible? And then these last couple, coherence is quite similar in that there are other kinds of evidence supporting causation. And I found this little diagram. I knew about first-hand cigarette smoking. I knew about second-hand smoke, but I didn't actually know about third-hand smoke. That's the stuff my parents both smoked when I was a kid, and the inside of the car liner was that yellow funny color. That's that third-hand smoke stuff. That's the stuff that precipitates down onto the surfaces where people smoke. And it turns out that if you take that and you expose mice to it, it damages their DNA and causes lung cancer. So this is a completely different approach, and yet it still supports the idea that there's something going on, and it gives us a potential mechanism for things going on. This stuff damages DNA. We know DNA is important in producing normal cells and controlling cell growth. And that takes us to experiments. There's a lot more stuff that we can do now than we used to be able to do in 1965. And the other thing that can be really helpful, which a couple people have alluded to here, is there something else out there that's similar? Can we jump on the same bandwagon and we say, we know that this kind of exposure can cause this kind of problem. The trick is, if we're talking about something like hip dysplasia, we don't know a lot about what causes hip dysplasia. I mean, we know there's a genetic component, and we know that there's this, and we know that there's that, but we don't know a lot about it at the molecular level. So it's really hard for us to make arguments and make those similarities clear. So it's kind of challenging, and that's why this is so contentious, because it's not clear. And I'm an epidemiologist. Epi studies can produce no evidence for causation, or really good evidence for causation. In our particular situation, there's three topics that I want to touch on that really illustrate why this is so freaking hard for us and why we haven't been able to do a lot, where in many cases, epidemiological studies can be much more helpful in proving causation. In this case, a lot of times sometimes we're talking about, are they neutered or not? And that's easier. But a lot of times we're talking about age at sterilization. And how do you know that? So if you have an animal and it's gone to the same veterinarian its whole life and the veterinarian did it, it's in the veterinarian's medical records. So if you're doing a study and you get to that veterinarian, you can ask the veterinarian, well, how do you get to that veterinarian? What if you ask the owner? Then the owner has to remember how old the dog was when the dog was spayed or neutered. And if the dog is 10 now, how many of you know how old exactly to the month your dog was when she was spayed? We're relying on owner memory. And if you're doing a study looking at age at neuter as your exposure, if it's missing from the record, you have to exclude that dog from your study. So what does that do to you for your study? Who does that exclude? It excludes dogs who came in as through a shelter very often, unless they were neutered at the shelter, and they came in already neutered, they're excluded. A stray dog who showed up on your doorstep who you didn't neuter, those dogs are excluded. Dogs who might be rehomed by a friend or neighbor, if they don't know when it is, they're excluded. So what does that do, and how can it influence the results? And the fact is that we know it has to influence the results, but we don't know enough about it to be able to predict what the kind of influence might be. So the second one is the kinds of problems that we're worried about. Generally speaking, we're worried about a bunch of different cancers, and we're worried about a bunch of different joint problems. There are a number of other health issues that do pop up, but these are the big classifications that we worry about when we're thinking about spaying and neutering and outcomes of concern in dogs. And the little diagram here is actually from the cow world, because that's where they've done a lot of studying about lameness. And that just illustrates how complicated it is to study lameness in cows, which are these are dairy cattle that they're talking about. So it's a very structured environment. And there's still like this diagram that makes you a little dizzy. If we're talking about joint problems in dogs, we know those are multifactorial. We know that the sex of the dog in some cases influences the breed, the conformation of the individual dog, the dog's body weight, whether it's a big dog or a small dog, and whether the dog is overweight or not. And we know for certain joint problems, the activity level and diet, as the dog is young and growing, can influence the occurrence of those diseases down the road. And so can diet and growth rate. So there's all these things, and we're trying to pick out just the slice of spaying or castrating the dog and figure out whether that's how important that is in creating these health problems down the road. So it's very complicated. And cancer is often an older dog problem, so we're dealing with this memory thing of this is happening in a dog who's 8 or 10, and we're looking back into this dog's history, and it's really hard to track that. And we don't know a lot about cancer in dogs. We know a lot about certain cancers in dogs, but not a lot about a lot of them. It's surprising. And we do know that certain breeds, like boxers, are much more commonly afflicted with cancer. And we know that even within breeds, there are certain lines that come from certain kennels. There are some specific genetic predispositions to certain kinds of cancers. So that makes those complicated. The final piece is, where do we get enough dogs to study? I mean, we're doing epidemiology. It's a population. We need to get more than 20 dogs to do these studies. Where can we find them? And in a lot of cases, the people who have both the dogs and the skills to do these studies are at veterinary schools or specialty hospitals, and those are not your typical private practice. They are usually referrals. They're often being seen because there was something complicated or odd going on. And, of course, the owners had the time, money, and ability to take their animal there. And any of you who've done this, especially veterinary teaching hospitals at the vet schools, you often sit there for very many hours. And they notice the disease and were willing to work it up and willing to do things about it. So these are not a random group of dogs. These are dogs who belong to people who are highly motivated for a variety of reasons. And it's plausible that they're also much more likely to be neutered. And then we ask ourselves, when we're looking at the impact of spay and neuter, are we only interested in dogs who see veterinarians? Depends on what the question is we're asking. And in some cases, and we can't really tell you, we don't have good data that say, how are dogs who see veterinarians different from dogs who don't see veterinarians? A lot of the studies have looked at specific breeds and breeds with pedigrees. We do a lot of work with folks who have Maltipoos and designer breeds, the little mixes, and if you ask them, they will tell you that their Maltipoo is purebred. What do I do with that? I also know in New York City, blue-nosed pits are highly, highly valued. Blue-nosed pit bulls are very highly valued. I can't tell you how they know it's a blue-nosed pit. And if you say, okay, well, to counteract that, we're going to go and we're going to talk to owners of dogs, then you're relying on finding people who have the knowledge and interest to participate in your surveys and are willing and relying on their memory and hopefully having good memories to tell you that. So that's really challenging. So you heard a little bit about behavior last night. It was mentioned as one of those things. I think Bob said, I don't want to say anything about behavior. I work with a number of animal behaviorists, and we've done a lot of work on certain kinds of behavior issues. And one of the things that they have impressed upon me is that behavior is contextual. What a dog does is related to that specific time, place, issue, situation. And the dog may react differently if you change something very slightly in that situation. That makes it really hard to predict what behaviors are going to be. We know that there are genetic tendencies in breeds. Border Collies tend to herd things. Labradors tend to eat things. And And even within breed, there are genetic predispositions. Some dogs will be very shy, some dogs will be very outgoing. We also know that the environment, how they were raised, how they were trained, how they were socialized, strongly influences how a dog behaves. And that can change over time. And the other thing that happens is that dogs learn that they like things. It's how they train you to get out of bed at 6 o'clock in the morning and feed them. If your dog likes to escape, that's what these guys are doing, jumping a fence. If your dog likes to escape and run around the neighborhood, he thinks that's way cool. Castrating him is probably not going to change that behavior because he's already learned to do it and he thinks it's pretty darn fun and it's worth the effort. And the other thing about behavior when we're thinking about it is some are much more objectionable than others. I object more to a dog who pees in the house than a dog who barks at strangers. So saying that there are behavioral differences is important, and there are different kinds of behavioral issues that we're concerned about, but it also depends on who your audience and what your goal is. And if it's a pet, some people have a lot more tolerance for certain behaviors than others. As you know, if you go to your friend's house and the dog does stuff that drives you crazy, right? We all have different tolerances. So I'm going to touch on this study. This is a study that looked at behavior. This was a comparison of surgical castration, dogs who were left intact, and dogs who were chemically sterilized with asterosol in Chile. And we wanted to touch on this because it has some interesting aspects of behavior. They were randomly assigned to one of the three groups. They were videotaped and they were tracked with GPS, and they looked at testosterone. And so they were able to look at testosterone and a whole bunch of different dog behaviors. There's several papers published on this. What they found, not surprisingly and appropriately, is that there was no significant change in testosterone levels for the controls, who we did nothing to, and that the castrated dogs had very low or undetectable levels of testosterone. Good, that's what we expect to see. That means that we're on the right track. What they found for asterosol is that there was a lot of individual variation about how much testosterone was produced, and in some cases it decreased and in some cases it didn't. And that's, you've heard a bit about that we're not really sure. And then the question becomes, well, how much of that, does that make a difference in the ultimate behavior? Do we really care what the testosterone is if the dog's behavior changes or doesn't? And what they found was that there was no consistent behavior changes based on the testosterone levels, and there was no association between aggression to other dogs and testosterone. So these were likely learned behaviors. When they looked at the dogs that were surgically castrated, these are free-roaming dogs, so they do what they please. They were videotaped and they were scored. There was no change in the frequency of dog aggression to other dogs, or sexual activity post-surgery. And this was some months later. There was an increase for asterosol. There was an increase in dog-related aggression and no change in sexual activity. And the controls had no change in either one. Again, this is supporting that our study design was okay. They didn't find any change in the home range, how far the dogs tended to travel on a given day in any of the groups across the pre and post times. No difference in their activity, their social interactions with people in Chile, in their community. And what they did find was that season influenced the level of aggression and the level of activity. So here's another potential factor that we have to think about if we're looking at free-roaming dogs. Probably less of an issue in pets, but especially if you live in even in the South, we know that weather and heat and cold can influence behaviors. So it was a really interesting study, and it showed that a lot of the behaviors that dogs do are learned, and that some could be hormonally related. So I'm just going to give you an example here of what's in the literature. Mammary cancer is generally believed to be less common in bitches who are spayed earlier. It's not completely, I would say there's probably some people who disagree with that. Out of the 6 articles that were reviewed, we recently did a manuscript that reviewed all of the different health issues in dogs, not behavior, but health stuff. There were 6 that looked at mammary cancer and age at spaying. And 5 of them showed that frequency of mammary cancer decreased with dogs who were spayed. It was protective. They were less likely. And it's something where we can use some of those other criteria for causation because there's hormonal stimulation. There's data in other species, especially people. There's receptors for estrogen and progesterone in mammary tissue, so it makes sense. And we know that if you give dogs synthetic progesterone, it increases cancer. So even in a place where there's a pretty good consensus of what's going on, 1 of the 6 articles didn't show an association. Prostate cancer in male dogs. Again, only 4 of the 5 showed that, in fact, it increased with castration. I think for many, many years we used to say it decreased, and it doesn't. And the mechanism's not really clear. There's some data in other species, but it's not really clear what's going on here. So why is that? Urinary incontinence. I think that pretty much everybody believes that spaying can lead to causes an increase in urinary incontinence, especially with age, older dogs. And there's some pretty good data that suggests that the earlier you spay the bitch, the more likely she is to develop urinary incontinence. And yet 5 of the 9 articles couldn't show a statistical association. The other thing here that I want to bring out is that what's the implication? Yes, it causes urinary incontinence. If you can't manage it with medication, it's really a nuisance. Wake up in wet beds when your dog sleeps with you. But by and large, most dogs are pretty easy to manage with medications nowadays. And when this research was done, they also said, so what's the deal? Your dog has urinary incontinence. And they're like, yeah, so what? We treat it. So it doesn't cause the owner to euthanize the dog, and it didn't cause the owner to rehome the dog. The owner just managed it with medications. There's also a possible interaction of the weight of the dog with the size of the dog, but we don't really know. So here's something that we know actually quite a bit about, and we still, and there's some good data on, we can probably make good arguments about the biological, physiological, chemical mechanism for this to happen. This is something we're convinced in, and yet we still don't know as much about it as we'd really like. So to just wrap up, the reproductive system is really complicated, and it's really strong, because if you don't have good reproduction, you can't keep your species alive. So we're trying to mess with a system that has a lot of implications to an organism's survival. There are potentials for unintended consequences, and we know that behavior is highly context specific. I put this little diagram here to remind us also that dogs are a species we've messed with a lot. On the one hand, that's kind of good, because they're a little more uniform genetically than other species. On the other hand, it's still a really complicated genetic system. And we're often dealing with multifactorial, multiple causes, multiple things that have to be present for the health issue to occur. I can't promise you, if you smoke a cigarette, I can't promise you you'll get lung cancer. And yet we know that smoking can cause lung cancer. So it's really hard to untangle what's going on. The other thing that I want to keep in mind that you've heard a little bit about is what's your goal for spaying and neutering, and what's your context? So what's the sort of risk-benefit that you're messing around with here? Is it a known dog? Is it a pet in the United States who see as a veterinarian regularly? Is it a free-roaming dog in Mexico or Chile or Bali or any of the other countries you guys have heard about? Is it a dog who's in the shelter? And again, what are the cost benefits for the potential risks and the potential benefits in that situation? So we need to think about that, and that will complicate things, but you can think about it as you're hearing about the potential products and their use in the field at this conference. So knowing more about the potential mechanisms for some of these adverse events, adverse outcomes, can really help. And if we can understand those, then the potential for non-surgical options could help avoid some of those. And our next speaker is going to be talking a bit about those. Oh, that's still me.
Thanks, Margaret. Great lead into the next presentation, where we will hear about some of the untangling. And we're going to take questions at the end of both presentations, obviously. So thanks very much.
Thank you, Margaret. That was a great prelude into what I'm going to be talking about. I am not an epidemiologist. I'm a physiologist. So the way I look at things, my lens is slightly different. And so I'm not going to argue either for or against the epidemiologic validation of the proposed mechanisms that led us to the testing that we did. We can discuss that during our question and answer session if there are more questions related to it. But I thought I'd start off talking about the hypothalamic pituitary gonadal axis. I know that Dr. Whedon discussed this briefly during our Reproductive Biology 101 talk, but just so that you all are with me still as I lead you down this path. For animals, and I'm talking about all mammals at this point, with their gonads that are with respect to primates that are still functional, we don't see menopause or the equivalent of that in domestic animal species. The hypothalamus produces gonadotropin-releasing hormone, or GnRH. We've heard about that drug a lot, but I realize that not all of us come from an animal health background, so it's good to have that little bit of review. And that hormone, again, which is produced by a part of the brain called the hypothalamus, goes to another part of the brain, or a near brain tissue called the pituitary gland. And like many glands, it produces hormones. And the hormone that I'm going to talk about today predominantly is luteinizing hormone, or LH. The pituitary gland, or more specifically the anterior pituitary gland, produces a lot of hormones. And again, we're just going to focus on the LH today. Luteinizing hormone, its main target are reproductive tissues, specifically the gonads. And after finding its receptors on the gonads, it induces gonadal tissue, both male and female, to produce estradiol and testosterone. Those are my cryptic forms or abbreviations for estradiol and testosterone. So after LH stimulates the gonads to produce these steroid hormones, the steroid hormones then will negatively feed back onto both the pituitary gland and to neurons in the hypothalamus, not specifically those that produce GnRH, but actually neurons above GnRH that produce kisspeptin, which then regulates the secretion of GnRH. So it's through these mechanisms by which homeostasis of the reproductive hormones is maintained in mammals. So what happens in the status without gonads? Well, the brain is still producing GnRH, and GnRH is still being received by the pituitary gland, and the pituitary gland is still producing luteinizing hormone, but there's no negative feedback because there's no gonads. So what happens to the feedback system? Well, what happens is luteinizing hormone continues to be expressed. And in some individuals, it's expressed up to 30 times the levels that we see in circulation in intact animals. And how long is LH elevated? Well, it's going to be elevated every day for the rest of that animal's life. And so therein lies the rub. If luteinizing hormone is only a reproductive hormone, then we wouldn't be having this conversation today. But luteinizing hormone has other targets as well. So as I mentioned before, we think of it as a reproductive hormone, and indefinitely it is used, it is a key for ovulation, for the development of the corpus luteum, which produces progesterone after ovulation, as well as stimulating the production of progesterone from the corpus luteum, as well as stimulating estradiol and testosterone secretion. But when LH binds to its receptor, it induces a number of effects within the cell. I've just identified two, which I believe are important for the non-reproductive effects of LH in cells. Those being involving the induction of cell division, so especially unregulated cell division that we see in hyperplastic and neoplastic conditions, and the release of nitric oxide. Nitric oxide is a powerful substance which results in vasodilation. It also results in smooth muscle relaxation, and this can contribute to some of the disorders that we see as well. So as I mentioned before, luteinizing hormone receptors, LHR is my abbreviation for that, are not limited to reproductive tissues. This is not an extensive list. I just have a few tissues listed here, and I'm going to go through even a fewer listing of these and how we believe these are causing problems in our dogs that have had their gonads removed. So we mentioned, Dr. Slater mentioned urinary incontinence before, and work has been done for more than a decade looking at the relationship between luteinizing hormone receptors and urinary incontinence in dogs. We know that luteinizing hormone receptors are present in the lower urinary tract, in all parts of the lower urinary tract, and within the epithelium, the stroma, and the smooth muscle within the urinary tract. As mentioned before, the causation related to spaying and urinary incontinence is murky. Some studies have reported an incidence of 50% of spayed female dogs developing urinary incontinence. The one that I've highlighted on the side reports an incidence of 5% of spayed dogs having urinary incontinence. I've seen many experts agree that somewhere in that range of 5 to 50%, maybe 20% is probably a more realistic average, but that's still a very high percentage of dogs developing urinary incontinence. Even at the lowest range with just 5%, that's still too many. As mentioned previously, there does seem to be some differences that we see in dogs. We very rarely see urinary incontinence clinically. In small and toy breed dogs, it's much more common in medium, large, and giant breed dogs. So again, over this 15 kilogram or 30 pound mark. And there has been quite a bit of variation in the literature with respect to the influence of spaying, at the time of spaying, and the development of urinary incontinence. In this particular study that came out in 2013, they found that there was no significant difference in the age at the time of ovarian hysterectomy between developing incontinence or not. But others, including Dr. Slater, have found that the age of spaying is correlated. So we know that gonadectomized dogs, or spayed female dogs with urinary incontinence, have a significantly higher number of LH receptors in their lower urinary tract compared to unaltered dogs. And unfortunately, this isn't a diagnostic test that you could do prior to spaying a dog to see whether they would be predisposed to developing more LH receptors or not. Urinary continence can be restored in gonadectomized dogs by reducing circulating LH levels. Now, initially, this was done by using estrogen replacement therapy. Predominantly diethylstilbestrol, or DES, was administered to dogs with urinary incontinence, and this was found to, again, restore continence in the majority of female dogs treated. Initially, this was believed to be a direct effect of estradiol levels, but now we know that this is mitigated or mediated through reducing LH levels and their effects on the bladder itself. We further proven that by taking estrogen and its negative feedback out of the picture and administering either a GnRH agonist, specifically Cipralerin, or GnRH immunization, both of these lowering LH levels, of course not adding estradiol to the mix, and again, restoring continence in the majority of the females that were treated. I just want to go on. One thing about urinary incontinence, as Dr. Slater mentioned, it certainly is a medical condition that many responsible pet owners will undergo the efforts to treat. But currently we have limited options. Again, there are estrogens or phenylpropanolamine are our main treatment options. And both of those can have very difficult dangerous side effects when administered to dogs. They both require daily administration, and especially phenylpropanolamine, because it's a controlled substance and it's only distributed by one vendor, can be quite expensive, especially if you have a large breed dog. And so unlike the experience related by Dr. Slater, I have had several veterinarians and owners tell me that if they have a large breed dog, typically what happens is that dog isn't allowed in the house anymore because they're incontinent. And so I worry about this particular disorder on the animal welfare level, that the human-animal bond is damaged when this dog becomes incontinent. And of course, it's not anything that the dog had any control over. It wasn't that it started chewing up the sofa cushions. It has elevated LH levels and could no longer prevent urine leakage. So again, I've limited my talk to just a few of those tissues, but I want to talk about the adrenal gland because in the adrenal gland, we know that luteinizing hormone receptors are present predominantly in the zona reticularis, which is the most central part of the adrenal cortex, as well as in the zona fasciculata, listed as ZF here, which is the central zone of the adrenal cortex. This happens to be in human tissue, and a lot of what we know, or what I know, what led me to the research that I do, is based on studies that have actually been done in humans, because during menopause, when LH levels become very high in women, we see many of the similar problems that we see in spayed female dogs. And so again, following in the footsteps of human physiologists that have looked at some of these conditions in humans. So this happens to be, again, human adrenal gland. In dogs, primates, rodents, we also know that luteinizing hormone receptors are present within the adrenal cortex. As I mentioned previously, a lot of work has been done in postmenopausal women. And the study that shows the diagram to the right illustrates a positive relationship between LH concentrations and cortisol concentrations, such that as LH concentrations rise postmenopausally, cortisol levels rise in circulation as well. A few years after that, another set of investigators demonstrated that LH receptors within the human adrenal gland have been shown to mediate an ACTH-independent Cushing's-like syndrome that occurs in postmenopausal women. So demonstrating that the LH receptors present within the adrenal cortex tissue in humans are functional and seem to respond to the high levels of LH that are present postmenopausally. So what about dogs? We know that, again, LH levels are high after spaying. And according to the study, and I have all of the studies listed here with just the first author's name and the date, but I'd be happy to provide anyone here with the full reference if they're interested. In this particular study, they looked at disorders that were increased or decreased with spaying or neutering or not being spayed or neutered. And the yellow that's illustrated here, this was a disorder that had increased incidence. It says early onset cataracts in dogs that were intact. But in dogs that had been neutered, so spayed or neutered, there was an increased incidence towards intervertebral disc disease, increased incident towards anterior ligament and cruciate ligament rupture, several types of cancer, but also towards Cushing's disease. And I've heard from several veterinarians over the last 25 years since I've been a veterinarian in practice, how there appears to be this incidence in Cushing's disease that they see, that they, especially veterinarians that are older than me, that they didn't appreciate in practice. And so based on both veterinarians' perceptions anecdotally, as well as some of these other studies that have looked at incidence and prevalence. There appears that there is an effect of elevated LH levels causing an increase in hyperadrenocorticism, or Cushing's disease in dogs. And we already know, using our ferret friend here, that neutering increases the risk towards hyperadrenocorticism, so much so that they are also at risk of adrenal tumor disease. And when these little friends are presented to us, how do we treat them? Well, we could treat them surgically if it is an adrenal tumor, but prior to actually developing a tumor, we treat them with suprelorin, which is a GnRH agonist, which decreases LH levels, and that returns them to a normal cortisol level. So again, more evidence supporting that hyperadrenocorticism is caused by, or maybe I can't use the word causation, can be related. Well, anyway. All right, so let's talk about some other tissues. So we know that the skin is loaded with luteinizing hormone receptors. We see it both within the epithelium as well as within the hair follicles itself. In fact, we used to use testicular tissue as a positive control for our immunohistochemistry experiments because LH receptors are present within Leydig cells within testicular tissue. But we subsequently found that skin is a much better positive control because the presence of LH receptors are more, there are more LH receptors present, so it's easier to use that as a positive control. Some of you may not be aware of this syndrome. We'll call it a syndrome. They call it puppy coat syndrome. But spaying results in these coat changes in about 20% of bitches, and we see it more commonly in long-haired dogs. It can also happen in medium-length dogs, but definitely spaniels, long-haired dachshunds seem to be more overrepresented with this problem. The pictures that you see represented on the right illustrate a Welsh Spaniel bitch who, prior to being spayed, and then 6 months after she was spayed, you could tell the time of the year is different there, the development of that puppy coat syndrome. Dr. Reichler evaluated puppy coat syndrome previously and found that the reason why we're seeing this change occur is the effect on hair growth. And so luteinizing hormone receptors within the hair follicle are affected and actually prevent the hair follicle from completing the hair cycle. They arrest the hair follicle in the telogen stage. And because of this, they don't shed out that hair like they should, and it results in this phenotype. Now, granted, this is not a medically dangerous condition. It's aesthetic. It is more difficult for the dog and the owner to maintain this hair coat because it's more likely to mat, more likely to be susceptible to pyodermas because of the thickness of the coat. But I've had some owners tell me that they object to the way their dogs look now, and anything that they object to, again, potentially could hurt the bond between the dog and its owner, and may result in increased likelihood towards relinquishment. You just don't know. So Dr. Reichler administered a GnRH agonist, and that resulted in the correction of puppy coat syndrome. We've also demonstrated this using GnRH immunization. So again, this is a LH receptor, LH-mediated phenomenon. What about another troubling endocrine problem, hypothyroidism? So previously, LH receptors had been shown to be present in the thyroid gland. Again, a lot of research was done in postmenopausal women because we see hypothyroidism at a higher incidence postmenopausally in women. So our lab was interested in seeing whether the canine thyroid gland also has LH receptors, and sure enough, it did. I'm sorry that the bottom bullet is covered up by the picture, but on average, the percentage of positive cells within the canine thyroid follicles was about 50%. So about 50% of the cells within the canine thyroid produce LH receptors. So what we know in humans is that serum LH levels are significantly greater in patients that have thyroid gland adenoma. So this would be enlargement of the thyroid gland associated with a decrease in production of thyroid hormone, so different than Graves' disease or hyperthyroidism. So as the thyroid gland enlarges in humans, we see less thyroid production. And women who have actually undergone gonadectomy because they have a primary ovarian cancer are also at a higher risk for developing hypothyroidism. And as I mentioned before, the incidence of hypothyroidism increases postmenopausally. So other investigators have demonstrated that gonadectomy has a profound negative effect on thyroid function. And in 2 studies, the authors claim that gonadectomy was the most significant cause, there's that word again, for the development of hypothyroidism in dogs. Different paper authors concluded that 30% more gonadectomized dogs developed hypothyroidism compared to unaltered dogs. And we know that thyroid hormone concentrations in gonadectomized dogs are significantly lower, even in dogs that are not showing signs of hypothyroidism and otherwise would be tested, but compared to intact dogs. So again, this is another study. Several studies have looked at different odds ratios and relative risks of long-term health complications with spaying and neutering, but this one evaluated hypothyroidism among others and found that in neutered females and neutered males, that the odds ratio was 3 or 1.3, and the relative risk was 3 or 1.3, so that much greater than in the intact dogs. Again, all of those disorders that I've mentioned, whether it's adrenal disease or incontinence, hypothyroidism, are medical conditions that can be troubling, but we have medications that owners can purchase from us, veterinarians, to treat their pets. But what about more complicated musculoskeletal diseases? And so the 2 that I'm going to hone in on are anterior cruciate ligament rupture, or in veterinary medicine, we usually refer to it as cranial cruciate ligament rupture. So I apologize for the differences in the acronyms, but because most humans are familiar with ACLs, that's why I typically use the human terminology when talking to humans. So in this particular study by Torres de la Riva, and I have a few different slides from their study kind of breaking down their results, but again, I'm not an epidemiologist, so I will neither, I will not defend their methodology, I'm just relating to you what their results were. In this study, they found that there were no cases of ACL rupture diagnosed in intact dogs. But in dogs that had been neutered early, both males and females, the occurrence was 5 or 8%. And so the reason why ACL rupture is more significant, let's say, than urinary incontinence is that the surgical repair of ACL rupture is quite expensive. Even best cost estimates, you're looking at well over $1,000. Can be, upwards of several $1,000s depending on what part of the country you live in and who your surgeon is. And even after surgery, just a show of hands here, besides me, who else has had an ACL rupture? Okay, so not actually that many. I'm surprised. So after you have your ACL repaired surgically, then you have several sessions of physical therapy. And even after physical therapy ends, you'll have several months, if not ongoing years, of NSAIDs to mitigate the pain that's associated with arthritis that develops secondary to that joint instability. So even the owners that are privileged enough to do the surgery for their pets, the long-term health effects of the pets are going to be affected by getting an ACL tear. And once they've torn one ACL, the likelihood that they'll tear the other ACL is even greater, even if they have that first ACL repair performed. And that, again, might be outside of the owner's budget. I mean, we might be able to pay for one ACL repair, but not the second one. And where does that leave the pet at that point? So our interest was, do these tissues within the knee, we refer to as the femoral tibial joint, have receptors for luteinizing hormone. And that had been one of those non-reproductive tissues that hadn't been previously studied. And so we were fortunate to work with some shelters that had some populations of dogs that for several reasons, could not be homed or rehomed and were euthanized. And so we were able to collect tissues from them after they were euthanized, so that some greater good could come from that particularly bad situation. And so one of my students, Claire Kiefel, in the audience, she has a poster that she'll be discussing this evening with these results, but I'll just give you a prelude for that. She isolated or dissected out the cruciate ligaments and the synovia from the knee joint, as well as within the hip joint, tissues within the hip joint, and found that indeed these tissues also had receptors for luteinizing hormone. So why is that important? Well, the reason is that we know that LH receptor activation can result in nitric oxide release. I mentioned that before as its mechanism. And nitric oxide is a powerful vasodilation, but it also results in smooth muscle relaxation. And that's how it relates to urinary incontinence. It relaxes the sphincter muscle in the bladder. So if it also is causing relaxation or laxity within the ligaments, this causes more joint instability and increases the risk towards developing these traumatic ligament ruptures. And so this would be a physiologic mechanism why we see this disorder occur more commonly in dogs with high levels of LH after spaying and neutering. Again, hip dysplasia, very complicated disease, many predisposing factors to it. But in this particular study by Witzberger, they found that independent of obesity, gonadectomy significantly increased the incidence of hip dysplasia. Another study evaluated, again, the incidence, found that gonadectomy increases the incidence by 1.5 to 2 times what we see in unaltered dogs. Again, even intact dogs develop hip dysplasia, so this is not an either-or phenomenon, and not all spayed or neutered dogs develop hip dysplasia. Going back to the Torres de la Riva study, you can see that even in their study, they show that hip dysplastic dogs are present in the intact group, which is the black bar, the early neutered group, which is the slightly lighter grayish bar in the middle, and in the later neutered group, which is the bar to the rightmost of the grouping. But male dogs that were neutered early were overrepresented, more than twice what that occurred in intact male dogs. So as I mentioned before, Claire was collecting tissue from these cadavers and looked specifically at the round ligament, which is the ligament that maintains the integrity of the femur within the pelvis, within the acetabulum of the pelvis, and found that that particular ligament was abundant with luteinizing hormone receptors, as was the bone, the subchondral bone within the coxofemoral joint. So again, using what we know, this could provide physiologic basis for why we see increased level of hip dysplasia because of increased ligamental laxity throughout these dogs. Even dogs that have normal hip joints develop increased laxity and then develop osteoarthritis secondary to that. All right, I've been given the 10-minute slide, so I've got to step it up to high speed. Lymphocytes are really interesting because why would...
Actually,
Over?
sort of at time already. We've got a little bit, but...
Okay, I'll finish up with this and I'll stop. Thank you, Gary.
Very much.
Okay, so this will be my last one, and then I'll stop. Canine lymphocytes express luteinizing hormone receptors, and lymphocytes being one of the types of white blood cells that are present in circulation, and they're the main white blood cell that's found within the lymph nodes. And so we looked at canine lymph nodes, biopsies of canine lymph nodes that had been submitted to our diagnostic lab. In those normal lymph nodes, about 4% of the cells expressed LH receptors. It seems like it's a very low number, but still unlikely. Why would the luteinizing hormone receptor be present in lymphocytes? We followed that study up by collecting blood samples from healthy dogs, determining whether those white blood cells, both the T and the B lymphocytes, expressed luteinizing hormone receptors. And indeed, what we found that, yes, both B and T lymphocytes express LH receptors, but we had a population of dogs that were spayed and neutered and a population of dogs that were intact. And what we found was that the expression of luteinizing hormone receptor actually varied based on their sex status, such that dogs that had been spayed or neutered had higher luteinizing hormone receptors, you can see the numbers there, in their T lymphocytes compared to the intact dogs. And so this led us to our research that we're currently working on in lymphoma. And we know that gonadectomy, or at least it's been reported, that gonadectomy increases the risk towards lymphoma. Again, the varies depending on which study you see, whether how great that increased incidence is. We followed up with our evaluation of normal lymph nodes by looking at neoplastic lymph nodes and found that the expression of LH receptors in lymphocytes from neoplastic lymph nodes was about 12%, so about 3 times more than what we saw in normal lymph nodes. Again, these lymphocytes have LH receptors. And so a criticism or comments that we had was that how do we know that these receptors are functional? And so we were fortunate enough to isolate lymphocytes from 3 cases of canine lymphoma. They were just abbreviated as CLC, EMA, and CLK to kind of keep the owner and pet's name anonymous. And we incubated those cells in culture, either with no LH agonist, we use HCG or human chorionic gonadotropin as our LH agonist, or at varying increased levels of HCG. And what we could do was we could increase cell proliferation. So we know that these LH receptors within lymphocytes can be induced to proliferate. The cells will proliferate with LH with LH. And so again, these results provide additional physiologic evidence to explain why spayed and neuter dogs develop lymphoma at higher rates than intact dogs. And we hope to be involved with future studies that would use suprelorin as a complementary anti-neoplastic treatment to increase survival times in dogs with lymphoma. So with that, I'm going to go ahead and stop since we're at time, and thank you. I'll open for questions.
Great. So there's 2 microphones, both places, and I'm going to jump in and use moderator's prerogative and ask one quick question. Thinking about LH now, which I never thought much about before, you had one slide at the beginning, Michelle, and you said that the concentration can be 30-fold over normal. My question is, how much variation is there after spay neuter? Do we know yet? Do some dogs have just 3 to 4 to 5% above normal, others are 30, or is it is everybody in the same lump?
Do I need to turn this on? No, okay. So it's not the same. And one of the initial kind of the low-hanging fruits was, well, maybe a dog that doesn't produce as much LH would be, or produces more LH after being spayed would be more likely to develop urinary incontinence, and unfortunately that's not the case. So dogs with the highest level of LH are not guaranteed to develop urinary incontinence, and dogs with more modestly, only 8 times the value, might end up developing urinary incontinence. Again, that's been studied more carefully with urinary incontinence, not with these other disorder. So there may be more of a physiologic relationship with some of these other problems.
There must be some other questions. Yes, but please go to the mic.
Sorry, Dale Anderson. Is there any support for researching tubal ligation or sterilization without removing the gonads?
Did everyone hear that question okay? All right. So so the short answer to that, I think that you can remove the uterus or just a portion of the vas deferens and achieve permanent surgical sterilization without having the effects of elevated LH that you see with removing the gonads. Having said that, I am not an advocate for tubal ligation because in dogs, the increased risk over time for developing pyometra, which could be a life-threatening problem, and even after the uterus is removed, could have long-standing effects on renal function or kidney function. So for that reason, I recommend if a gonad-sparing surgical sterilization option is sought, to use a hysterectomy that includes removal of the entire uterus, not just a portion of it.
With the growing concern for the side effects of spaying and neutering, why aren't people doing it more?
Anybody in the audience? So go ahead.
Yeah, please come to the mic.
I mean, some of it is the behavioral issues of bitches when they cycle, but go ahead.
So I'm Sarah White. So from my perspective as a spay-neuter vet, I would expect that procedure to take quite a bit longer because removing all the uterine tissue from a dog requires a much longer incision, actually, because we normally leave the cervix and the little bit of tissue that's beyond that. So it would actually be a procedure that takes twice as long, and it's not, as Margaret was saying, not what the clients are expecting from a spayed dog. So I think it would be most likely in a private practice setting where there's a long-term relationship between a veterinarian and the client. To understand that the dog is still going to have behavioral heat and all that stuff.
So just to follow up with that, when we do ovary-sparing hysterectomies, the incision isn't any longer, it's just different. So instead of being further anterior on the midline, it's further posterior on the midline so that it facilitates removal of the uterus and the cervix. Since you don't need to remove the ovaries, you don't need to extend that incision as far towards cranially. And so again, any new surgical procedure a veterinarian were to adopt initially would take longer than what they've been accustomed to, but performing an ovary-sparing hysterectomy can be just as quickly done in dogs as a regular hysterectomy can, and it can also be done in very young dogs. We routinely do this now in 5 and 6 and 7 and 8 week old puppies that are sold into pet homes from purebred dog breeders so that there's no possibility of unwanted litter production, but they still have the opportunity of developing normally with their gonads, and then could be have their gonads removed later on in life.
Okay, we have time for only one question, and then obviously everybody will be at the break and dinner tonight. Sir.
Thanks. Darren Noble from Ross University. I just want to thank both speakers, and particularly Michelle. That was really interesting, and I had no idea of these potential links between, or this explanation of biological mechanisms for the links between ovarian hysterectomy and some of these diseases that are seen really commonly in veterinary practice. And I think it's putting a lot of pressure on us epidemiologists, so I'm an epidemiologist, to actually design rigorous studies to demonstrate this effect, studies that can really demonstrate causality. And I think maybe we're coming to the point where a randomized controlled trial would be the way to go. And I don't, Margaret, has anything been done like this? And obviously it would really need to be done on scale in order to be able to demonstrate these associations.
Yeah, I mean, there was a couple of studies done very early on where there was about 2 years of follow-up that were randomized. The trick is getting people to buy into that, to do it at scale. And I was wondering in listening whether it would make sense to go to some of the countries like Norway and Sweden where most of the dogs are intact, and look at some of the prevalence of some of these diseases as well and see whether that might help answer. But that's not without challenges too.
Great. Well, join me in thanking our presenters, please.